We're live. Hello, everybody. I am Lana from Tell Me Baby. Thank you so much for joining us tonight for our TMB TV series, Pregnancy, Birth and Beyond. Tonight's TMB TV is brought to you by Mustela, who make natural and safe skincare products for the delicate skins of babies, children and pregnant women. We are so happy to be back again with Tylah, our midwife, who's based in Sydney. Hi, Tylah. Thank you so much for joining us again tonight.
Thanks so much for having me again.
It's so good to have you here. I look forward to these every single month we're doing this. So we always have the best chats. We get to go through so many amazing questions. And I'm really excited tonight because we are talking about the stages of labour and preparing for hospital. So if you have any questions, please leave them in the comments below. We're going to try and get through as many of them as we can tonight. We've already had a heap of questions come through, so we're going to try and get through them all. And also thanks to our partner Mustela, we're giving away some Mustela goodie packs for mums and bubs. So to enter, make sure you either leave a comment or say hi or just let us know that you're here, and we're going to be announcing those winners tomorrow. So before we start with our audience and community questions, Tylah, what is the one thing that you wish women knew about labour?
Well, that's a very weighted question, but yeah, I think there's many things that I could go on for days, but the biggest thing that I would probably say, that mindset is everything. I think we worry about preparing all these small details and what to pack and, how's it going to be, but getting it right in your head first is the most important thing that you can do.
Yeah, I agree, 100%. All right, so we're talking about stages of labour. Can you tell us what are the stages of labour? How does it all work? How many stages are there?
Mm-hmm. So midwifery wise, and I guess obstetrics wise as well, we do define labour in 3 stages, but it does seem like a bit of a write-off, and I'll explain that a bit in a bit more detail. So first stage of labour is actually from 0 to sort of like 10 centimeters is the whole thing basically. Nice. And then you've got second stage, which is fully dilated, and third stage, which is birthing the placenta. But that first stage is broken up into what we call like latent phase, early labour, and established labour. So established labour is from 4 centimeters above. And in some cases now we're considering it could even be from 6 centimeters above. And then, you've got then that active labour and the second stage, which is fully dilated. So most of that work's done in the first stage, even though it feels like it's just at the beginning. It's really a lot of the brunt work is done there.
Yeah. Okay. So Megan wants to know, how will she actually know that first part of labour, that first stage of labour has started? What are some of the warning signs, I guess, to look out for?
So I imagine, women get very frustrated by being told, oh, when you know, you'll know. I think that's such a classic piece of advice that's given, but is not helpful at all to a new mum. A lot of people describe like the very early signs in the starts of labour as just feeling slightly different or a little bit off. That's how it can start. They sort of just, maybe it's a little bit sick, almost like just before you come down with an illness. You sort of know something's coming, but you're not quite sure, and that's how it normally starts. In terms of what sensations you'll feel in your body, it generally starts as either period-like cramp, so just a bit of cramping irregularly, or a bit of back pain. You can also find emotionally your emotions are more heightened, or things around you are affecting you more. It's a full like whole body experience in terms of as things start.
It's fun, isn't it?
Another thing as well is the mucus plug. So a lot of women might, get that mucus plug, which I just describe as like a bit of snot, as nice as that sounds. But that you can start losing that anywhere between sort of like 1 and 2 weeks before labour starts. Another common sign is the bloody shows. So a little bit of bleeding, like on wiping, and maybe a little bit on the pad. And generally speaking, it'll be about 24 hours after this that labour starts, but it's not a hard and fast rule.
Yeah, I guess everybody's different, right?
Exactly.
So what are some of the things that can make being in labour at home in that early labour period a little bit more comfortable? What are some of the things that you can do?
I think the biggest thing is not being too logical about it. And I wouldn't necessarily say time the contractions from the first one you feel, or start to think about things and, you know, adrenalize yourself. What you really want to get into, you know, we live our lives in this logical mind, but you want to get back into that primitive mind. So you want to do things like continue to do the housework. I think that's a great thing to do. You know, you're both nesting and you're mobilizing, you're moving your body around and preparing. Things like even whatever your comforts are. So watching TV or reading a book is a beautiful thing. Having a bath or going for a walk. You've almost got to pretend it's not happening, and that's the best way to get it to happen. It's a bit of a, you know, catch-22.
Yeah. Don't focus on it to make it happen.
Yeah, exactly.
All right, so we've got another one about labour. So my friend told me that she was labouring at home, but when she got to the hospital, everything stopped. Is this a myth? If so, what can I do to prevent this from happening?
This is a really good question, and actually quite a common experience for especially first-time mums. When you're going into labour at home, you're in a comfortable environment, you feel safe, all the right hormones are flowing, you've got the oxytocin flowing, and often at times you'll find it will either be late at night or early in the morning. It's nice and dark, your melatonin's heightened, which heightens your oxytocin. All the right things are happening. You know, your partner might be there, you might be having a bit of a cuddle or a kiss in bed, just feeling really safe. But think about it, when you sort of get up, get into the car, you start going to the hospital, this is when the adrenaline starts kicking in, and even excitement can produce that adrenaline. And you start getting that logical mind again. Where are we going? How long do we get there? What is it going to be like when we get there? And all that hormones start sort of, you know, causing a bit of havoc. So there's sort of two things that I would do here, depending. The first thing would be recommending, again, staying at home until those contractions are coming like hot and heavy, like, and you're really having to, you can't talk through them, you're really having to focus to make sure you've really kicked over. Because a lot of the problem with first-time mums is they'll teeter in between that early and established labour stage, about 2 to 3 centimeters. And sometimes all they have to do is let go and just relax to really get themselves to kick past that into that established labor. If you are at the hospital, it's really taking control of that environment and knowing that you have the power to take control. You can ask for the lights to be dimmed, you can play your favorite music, you can put up family pictures, you can diffuse like lavender or something that's going to make you feel more comfortable, and all those things to get that oxytocin going again.
Yeah, absolutely. All right, so kind of related to that a little bit. So this question for us, she says that I'm scared of losing control over what's happening to me during labour and birth. Do you have advice for me to stop this from happening?
I think the first thing would be to let go of that fear. As you know, again, catch-22 as it seems, I feel like labour and birth is absolutely packed full of life lessons. You're not just having a baby, you know, you're basically downloading an encyclopedia of lessons for life. And one of the biggest things is learning to surrender and let go. And again, we're in this environment where we're like in the rat race, chase, but that doesn't really work with labor at all. It doesn't really pair it up. It's sort of, if you think about it, it's like when you're trying to sleep, if you think about going to sleep, you're not going to go to sleep. It's really surrendering to that experience. So I would say the best thing would be working on those grounding techniques, breathing techniques, and meditation techniques. Some women develop little techniques. They'll bring like a comb and squeeze their hands on the comb during the contraction, or with their partner, they'll use those pressure points, and they can be things that really center you. There's an acupressure point right on the ball of the foot that you can press in. We call that the bliss point. So imagine like these were your toes, it would be around here, and that can be something that's really grounding as well.
Yeah, okay.
So they're all things, it's just looking at all the sort of tools you have available and making sure that you use them.
Take the toolkit with you to the hospital, hey?
Yeah.
So Sarah wants to know, does she have to decide what she wants to do about pain relief before labour starts, or can she see how she goes?
100%. One of my favorite things is women come in and I say, okay, like, what plan do you have? And like, I don't have a plan. I'm like, great, cool, we can work together. I think it's important to be educated about your options so that you can make an informed decision, but you don't necessarily have to have decided what you want at that time. A lot of women, what I'll use with them is what I call like a scaling up method, where we start with natural pain relief. And I say, look, we'll start with heat packs, we'll start with massage, shower, bath, things like that, step that up, and we'll use them as you need them. And then if that's not working, we'll jump to sort of like the drugs or the pharmacological side, where we use things like gas, morphine, and if they really need it, like epidural. So I think that's a really good way to do it. Just sort of scale up as you go and as you need it.
Yeah.
But you definitely don't have to have a plan. Just be informed of the risks and benefits of everything.
Yeah, absolutely. Okay, so I've heard women say their labor lasted for days. Can you explain why this is?
So this is such a common experience for first-time mums. And I think also something that scares mums like to the ends of this earth. And I think it's sometimes an awful thing for other mums to say to mums, and I know they don't mean it intentionally. It's almost this badge of honor. I was in labor for 3 days, but I think, as expectant mums, it can be difficult to hear. And what they don't mean that they were in rip-roaring labor for 3 days with contractions coming every 2 minutes. No woman could really sustain that. And that's potentially where there would be problems. And that's where a hospital is required. But what they do mean is their contractions started slowly. So you might get one an hour, then one every half hour, then one every 15 minutes. And in this time, you can still sleep between them. You can still do what you need to do. And it's such an essential part of the process. So to explain dilatation a little bit to you, everyone thinks it's about the centimeters, 1 to 10, and that's it. And so they get very disheartened if they go to the hospital and they hear they're only 2 centimeters. And that ruins their whole mindset and really sets them on a bit of a fork in the road to not a necessarily positive birth experience. But how I wanted to explain to you is the cervix actually starts off on baby's head 4 centimeters long. So as you can imagine, it's like if you stuck your finger up your nose, that is how long a cervix is. Like if you went right up, and that's what it feels like. That's how we start, like this big funnel. That early stage of labor, that 3 days of labor, is shortening that cervix till it's paper thin. So it goes, if you can imagine, from like your whole nose right to like the skin between your fingers, that thin. So that's the work that it's doing. You might stay 1 centimeter the whole time, but you've shortened a cervix, and then all it has to do is sort of open, and things go quite quickly from there. So it's realizing that no work that your body's doing is wasted effort or it's not working. It all is part of the plan, and it's surrendering to that.
Yeah, absolutely. Surrendering is absolutely the key word.
Yes.
Okay. Can I eat in labor, and should I bring snacks?
Yes, so I definitely advise eating in labor. There will come a point where your body says, I'm done, no more food. So early labor, to sustain that energy, especially if you're at home, but also in the hospital, you can eat. So bring some of your favorite snacks. I mean, you can bring things that are easy sugar, chocolate and things like that. Or if you want to go sort of fruit and nuts, it's whatever you are going to feel comfortable with. But there will come a point, like we're saying, this established labor, 4 centimeters or above, where your digestive system's like, nah, I got more important things to do. And you'll either throw up or just sort of lose your appetite. So while you have that appetite, get that energy in.
Yeah. Okay. We've got quite a few questions that are coming through. Is it still called first stage of labor if you've been induced and contracting for hours but not dilating?
So this can be a really difficult experience, and I completely understand. When we're using synthetic means, the body does react to it a little bit differently. And this is why we find sometimes, well, quite commonly, first-time mums going through an induction might need an epidural because they are constant contractions. It is still what we classify as first stage of labor, but it's something that you really have to frame for yourself going in as like really trying to sleep and relax as if you're at home. I know it can be difficult, but while you're in the hospital, really just trying to calm everything down, because once you crack on to established labor, that bit's often faster than what someone who isn't induced. So know that like you'll get your time, you'll get your reward. It's just at the end, not the beginning.
Yeah, absolutely. So we have another one that's coming live on, is there anything that I can do to help myself not feel so anxious after having a traumatic birth the last time?
I think the best thing is to recognize what you've been through, and it's not something that's commonly talked about. Think about like the small experience. It's like women who have had traumatic births. It's such a small part of the population, and not everyone's understanding of that. So I think the biggest thing is to talk about it as much as possible. You're completely entitled to go to your hospital and ask for a debrief with care providers that might have been involved, or even see a midwife who can talk through your notes and experiences with you. So if this is something that you feel is going to allow you to free up a little bit and understand your next birth, then I would 100% recommend doing that. Even as you book into the hospital the next time, it's a discussion that you can continually have. But I think the biggest thing is like researching and sort of looking at your options so you can go in feeling a lot more empowered this time and making choices that you might want. Another thing to consider is counselling or seeing a psychologist, because like I said, the most important thing with labour is that mental aspect. And if you need a little bit of assistance for that, that's probably the best thing that you can do for yourself in preparation.
Yeah, absolutely. Hopefully next time round goes well.
Yeah.
Okay, we've got a couple of questions around placentas. And
yes, love placenta questions.
Specifically around anterior placentas. So there's a couple that have come through, so I might just group them. Does having an anterior placenta make labour more painful, and does it change your pregnancy and birth at all?
So there's definitely no evidence-based documentation that a placenta being anterior, and what we're speaking of for those people listening at home is your placenta can sort of get sighted anywhere around your uterus during the pregnancy. So it can be like more towards your, like facing your spine, and what we're saying with anterior is it's sort of like your belly button's here and the placenta's like light up against the belly button almost. But it's definitely nothing to worry about. The only thing it does changes sometimes is how you experience movements, because they might feel a little bit cushioned as baby kicks into your stomach, and that's just something to be aware of, to track, you know, what movements are normal for you, but don't let it be something that's going to freak you out or you're going to panic over, because it's just a variation of what is normal.
Yeah, I had one with my second, and it didn't couldn't even tell. It was, you know.
Yeah, awesome.
Yeah. Okay. When do you call the hospital? When you realise you're in labour, or when the contractions are close enough apart to be admitted?
That's a great question. So some hospitals have different recommendations, and having worked at 3 different hospitals now, they sort of want different things. So I'd say this is a great conversation to have early on in your appointments, because some want to know from the hospital perspective, and to try and understand the birth unit sort of want to know what labourers they have, what we say like out in the wild, who's out in the community and who could be possibly coming in, so that we can organise things from a bedding and staffing perspective. However, some hospitals are sort of on top of that, and I find the ones that have, you know, a much larger amount of women coming in to sort of minimize the amount of phone call triaging, they would rather you call once you think like this is it. So talk to your hospital about which they would prefer, but it is completely okay. Like if you're unsure, it's always okay to ask for advice, and know that that's well within your right to call and ask.
Okay. So we have an anonymous question here. I'm in my first trimester, 8 weeks, and have experienced spotting and slight bleeding. Is this normal?
So it definitely can be normal, but it can also be abnormal. So I can't give you a direct answer, but what I think, you know, instead of sort of researching and scaring yourself online, I would definitely talk to your GP, partner with a good GP who's got experience in gynecology and things like that, and obstetrics, to really get that reassurance and that information firsthand, or if you're going through the hospital then. But I would say just try not freak yourself out over it, because, you know, it's almost counterintuitive. The more stress and things that are going through your body isn't going to help it. So just try and say, relax, look, I'm okay. I'll talk to someone, you know, who's definitely going to be in the know.
Yeah. Okay, so we've got one here from Deb, and she wants to know, what do I actually need to pack in my hospital bag, and what should I pack for my baby's first days? Don't do what I did and take 2 whole suitcases. Don't need
exactly. So yeah, one of my favorite activities is sort of like pack muling all the women's bags around, and all the things that they've brung. So most hospitals are actually going to have a packing list of what they would like you to bring, and they would like all women to have. I would definitely go with the consensus of less is more. You actually find like the biggest thing is people forgetting the essentials. So I would just look up online like a normal packing list that you would take to travel overseas, and that's where you start. In terms of everything extra, some people pack a little bag for baby. So what I'll say is just take a baby's going home outfit. I know, like, you've been given all these beautiful clothes and you want to use them, but the last thing you want to do when you get home is be washing all these outfits that you wore in the hospital. The hospital will actually provide sort of clothes. They either just have babies wrapped with nappies, or you'll have little baby gowns. So I'd say just that going home outfit really is all you need in terms of like what babies should wear. The biggest things for packing that I find women really like is the sort of disposable underwear on the incontinence underwear, because it is all a bit of like a mess in terms of like blood going everywhere and things like that. So it's nice to just keep things as easy as possible, things that you can throw out, clothes that are just nice, flowy, and that you're comfortable in.
Yeah. Yes, absolutely. Okay, when would you recommend to give baby their first bath? And what would you recommend to use for that?
So generally, the general rule we give within the hospital is that we wait the 24 hours. And this is for two reasons. The first is because babies, really small, just coming out of a very regulated environment, can find it hard to regulate their temperature. So the first advice would be just wait a little bit so that they're able to do that. And the second thing is that what's going to keep them more settled within that first 24 hours is if they can smell that amniotic fluid on them. So if you bath them straight away and wash all that off, they might even be more sort of like disorientated now that they're in the real world. That being said, though, it's 100% up to you. If you feel like you want to bath your baby 4 hours after birth, you go ahead and do it. You're in control. It's your baby, and it's important to remember that. You're going to get all these advice and told things, but ultimately, you can step up and make the decisions for your baby. In terms of what to use, it's completely up to you. Some people use nothing, but often that you find like that first bath after the birth, that baby is going to have sort of blood and gunk over it. So the biggest thing that I would recommend is making sure that whatever you're using is baby friendly. So our sponsor actually does have a gentle cleansing and a newborn foam shampoo, so you can use something like that, but it's also making sure you have little cloths or things to be able to wash everything out the hair, but making sure that you look that everything's baby safe and friendly, because you can get nasty fragrances and things like that you don't want to use.
Yeah, absolutely. Natural and safe, the way to go. We have one here from Claire, and she says that she is 27 weeks pregnant with her first baby and would like to opt for a natural birth. When should I create my birth plan, and are there templates available? Do I discuss this with my midwife or obstetrician, or both?
Yeah, so this is a great question. There's definitely templates online. But as midwives, we're almost superstitious. So I want to explain a little bit about this. The birth plan is not actually it's not actually necessary about having a birth plan, but it's about compiling a birth plan so that you can consider, okay, what are actually my options, or what are things asked? So for example, on a normal birth plan, it might be like, I want to have continuous skin to skin for 2 hours. If you hadn't sat down to do a birth plan, you might not have known that that's an option, or that's something that you can sort of campaign for. So I would say go through the plan, but sometimes when women come in with very long birth plans and, they're very attached to the idea, it can work to their detriment. So I would say definitely have something written down and definitely research, but also be flexible and open for things to happen as they need to.
Yeah, information is key, isn't it?
Exactly, yeah.
We have so many questions coming through. We're going to get through them all. This is amazing.
Awesome.
Okay, so I want to breastfeed. Is there anything I can do beforehand to stop from getting cracked nipples?
Yeah, so that's great that you're already starting to think about breastfeeding. And I think that's one thing, like, women are so busy preparing for the birth that they don't really think about, what comes after. So first of all, like, hats off for starting to think about that. Cracked and damaged nipples is definitely a common experience among women, and especially at the start. I would describe it, if you want something to relate it to, as sort of like nipple chafing. It's that sensitivity. You've never had, a baby sucking on your nipple before, and for like 60 minutes at times. So there's a few things that you can do. One of the biggest things, we would make sure that you're feeding right first, so that you've got good attachment. So within the hospital, talking to the midwives or a lactation consultant, if they're available, is important. The next thing we would advise to do is sort of like let them air as much as possible. And although it can be hard at the moment with visitors not necessarily being allowed in the hospitals regularly, it can be a bit of a bonus because we often see like going into rooms with women, and women have their shirts off and they're just letting their nipples air out. One thing that women also find really helpful is using ice or pain relief. And another thing as well is using sort of like any nipple creams. So our sponsor Mustela has a nursing comfort balm, but you can sort of look and see what options are going to fit you best. They're not necessarily always evidence-based, but hands down, women always use them. I always see them beside the bedside, and women are loving them. So definitely do some research and figure out what's going to be best for you.
Yep, let them free.
Yeah.
Okay. It's been a year since I gave birth to my first, and I'd like to start getting my body prepared to support another little one, but I'm stuck as to what I can do. What do you recommend the second time round, and given that the body has already gone through labor once?
So I think this is a beautiful question, and it's great that you're starting to focus on preparing for birth and also thinking about yourself and your body. I would say with anything, it's like trusting your body's done this once, it's going to do it again, and pretty effortlessly. So a lot of women find a much easier experience the second time round. With anything, it's important to, I would say, exercise regularly. Like we said, labor's a marathon. You really want some sort of level of physical fitness, whether it be going on walks every day or loosening up those ligaments and doing yoga. I would say sort of develop a routine in which that you're doing something to nourish your body, eating good food, staying hydrated, all the basic things. I think you almost want to think as you do have the answers. So sit down and have a little think about what you might need, ask yourself. Other things you can look into if you're interested is seeing a women's health specialist physio, and they can make a full assessment of your pelvic floor and sort of develop a program for you and work out, if there's anything you need to build up before falling pregnant again. But yeah, the biggest thing as well, mentally preparing for that second baby is probably, a challenging thing as well, and something to think about in terms of how you're still going to get time for yourself and look after yourself.
The game changes when you go from one to two. Okay, so we've got a couple more questions around labour here. So Miranda wants to know, how far along in labour do you have to be before you will no longer be given an epidural?
So this is good. And what I like to say to women is, unless you're crowning, you can get an epidural. It might be discouraged. Say if you've made it to 9-10 centimeters and you're almost there, it's almost a much easier process for you to just push that baby out, like you're almost there. It's also a lot lower risk to just sort of do that if you're almost there. But that being said, you should never be denied pain relief. And this is something that, you need to really go in understanding. Yes, someone might not recommend it, but you still have a right to that. So say, for example, if you're 8 centimeters and you're like, nope, I'm definitely decided on the epidural, the midwife's trying to encourage you and it's like, no, you don't need it. You're well within your right to say, no, actually, I'd like to speak to someone else and I'd really like to get that epidural. And I think if anything, this just helps you release that fear that you're not going to get it in time. It's just knowing that, if you really want it, you can get it. Like I've seen women like close their legs, hold baby in and get their epidural. The epidural's in, barely working it, and they push baby out, but they're happy as anything. So ultimately, we just want you guys to be happy and, be making choices.
Yeah, absolutely. Okay, so we've got one from Kendra, and she wants to know, is it better to tear naturally or to have an episiotomy, or leave that up to the midwives to decide?
So this is good. This is definitely sort of a very circumstantial based question, but I'll start by answering it simply is yes, ultimately it is better to tear naturally. Evidence suggests that we know that a tear is going to heal, much better if you do tear naturally. That being said, why we give episiotomies is not to necessarily prevent a nice small natural tear. It's if we're concerned that you're going to get a serious tear. So if we think that tear is going to be sort of like, altering to your lifestyle, they're what we would call 3rd and 4th degree tears, where they enter the anal sphincter and can lead to things like incontinence. We'll often divert the pressure through an episiotomy. And mostly, like, what I would say is you can go in preferencing, like, I would really only want an episiotomy if it's an emergency or if it's really deemed necessary. And I think what this does is it gets your health providers to, maybe if they're like, oh, you could have one, you can't, or you might not need one, I don't know, or maybe just give one. it could maybe allow them to step back and reflect on whether you really need one. So that's potentially what you're wanting to do, just making sure that if it's necessary, it's really necessary.
Yeah, absolutely. Okay. Louise wants to know any tips on avoiding experiencing postpartum depression or the baby blues.
I think the biggest thing is knowing it's not necessarily something you avoid. So if it comes on, it's not as if you've done something, you know, you're like, oh, maybe if I prepared more, or maybe if I did this. Like, there's definitely no blame game when it comes to depression. It is something that just happens. Baby blues and depression is sort of two different categories. So I'll start with baby blues. I think the most helpful thing to understand is that baby blues will happen. And if you have awareness of that, and in the time you can be aware of that, you're going to have a lot of an easier time. What I also say, yes, there's baby blues, but there's also what we call baby pinks. And they're the highs, you know, you're crying because you have so much love for this baby that you made, or, you know, your partner might have done something really cute after the birth and you're just so emotional and so full of love. So know that you actually get both, and it's not just fearing the blues, but knowing that it's a roller coaster of both. In terms of depression, the best thing that you can do is get onto it straight away. So if those baby blue feelings last longer than 2 weeks, you're going to want to see your GP. And it's not something to hide or trying to fight through. You've really got to think about your child as well. The best thing you can do for them is to get that help earlier on, because we know that depression in that early stage can affect things like attachment, and affects the way your baby grows up. So see it as something that you're not only doing for yourself, but for your baby. Know that it is super common. It's a hormonal change. It's a lifestyle change. And it's not something to be ashamed of. It's something to be like, right, yep, I've recognized that. I'm proud of myself. I've got help and I'm sorting it out.
Yeah, 100%. No shame in reaching out at all. Okay. So Mariam wants to know, does taking painkillers prolong labor?
So there is some evidence to suggest that something like paracetamol can extend that early stage of labor, but I wouldn't say it's necessarily conclusive. So it's a decision for you to make, and something that maybe you want to now take on and research yourself. There is some evidence that things like getting an epidural can slow down labor, but it's not as simple as like epidural in, right, now you've added 10 hours onto your labor. There's so much other factors involved in terms of, mobility, oxytocin receptors. You know, I've seen rapid births with an epidural, you know, where they've been 1 centimeter and then pushing baby out in an hour. And I've seen really slow births doing it all natural, and vice versa. So I think what you need to do is have a look at the evidence. It's all about what level of risk you're comfortable with, because it's going to differ from woman to woman. Some women say, yeah, there might be a higher risk with an epidural of forceps and vacuum, which there is, but I'm completely comfortable taking that risk because pain's a really big concern for me. Whereas some women might say, no, that I'm not interested in that. That's not what I want. So I'm not going to take that risk. It's about making those individual choices for you.
Yeah, that's it. Okay, so Kendra wants to know, my hospital says they induce if baby is still in by 40 weeks and 10 days. Is that normal and safe?
Yeah, so it's great to start to look into these things. And I know, you know, as that date goes past, it can be something that is quite anxiety inducing. So I recognize that. We classify term labor as that 42 weeks. So the hospital sort of covers everything by, sort of covers everyone by doing it by that sort of 40 and 10 days. What I would encourage you to do is definitely do some of your own research in terms of like why it's done and what's recommended and what sort of risks you're faced with. If you have a completely normal pregnancy and you would like to give yourself a bit of time, again, like we said, it's whatever level of risk you're comfortable with. So we do know that the rate of stillbirth goes up very slightly after 42 weeks. It actually is more significant after a pregnancy of, say, 44 weeks. But if you're otherwise all healthy, that risk is really low. If you have quite a lot of complications in pregnancy, it might be more wise to bring that induction on earlier. But again, it's taking it into your own hands and doing the research that's specific to what you need. Yeah.
On induction, so we've got another one here specific from on when being induced, is the tape gentler than the gel? I had the gel and my contractions were horrendous and I didn't dilate much. With my second child, they used a tape and the pain was a lot less severe. Is this something preferred by midwives nowadays?
So we actually have two ways in which we generally do induction. One's mechanical, and we do that with what we call a Foley's catheter. So it's essentially a Foley's catheter that gets inserted into the cervix. It's quite small. We push it into the cervix and we inflate a balloon. So a balloon will sit at the top of the cervix. Then we pull the catheter down and we'll tape that to the woman's leg. And so it'll put pressure on the cervix and mechanically open it. The other way we do it is through using sort of a medication or hormones that contribute to that. And the two that you're talking about is what we call Cervidil, and you can get a tape with that, or Prostin. So one of the benefits of the tape is that we can pull it out. So if you're having too many contractions, we can pull it out and that'll slow it down. Whereas the gel, once it's inserted, it's there. I think your body's going to react to things very differently, and it's not necessary to say one did worse than the others. Some women have Prostin and nothing happens, like they just sleep all night. And some women have them and have a baby 4 hours later. But having your care provider explain your options to you and actually allowing them to give you alternative options for you to consider is really important. Often women are just told, right, you're booked in, this is what's happening. But it's for you to have that power and confidence to say, actually, what are all my options? Put them on the table and let me decide.
Yeah, absolutely. Okay. During labor, I have had back-to-back contractions with no breaks. So one contraction starts up as soon as one ends. Is that common, and can I expect that each birth?
Not knowing your situation would be very hard to sort of understand, but what I could take from what you're saying is potentially they'll come in like minute by minute. It's hard to say if it was normal birth or an induction. Often an induction, that can happen because we're synthetically controlling your labor. So some women can have 6 up to 7 contractions in 10 minutes. What the normal body hormonally will generally produce is that 4 to 5, that are lasting for a minute and a half, and you'll have that break in between. So it really depends on what's happening. So for a blanket answer, I would say naturally, no, that's not normal, but with an induction, yes, it is. And that's something that it's important to communicate to your care provider that they need to titrate that medication down because you're not coping and they're coming too close together. We don't want them that close together because that's going to make baby way too tired. So it's keeping that communication open between you and your care provider about what's going on. And if that's a concern of yours, bring it up. Say, last time this happened, I'm concerned. Can you explain to me why it might have happened and what we can do this time?
Yeah. Okay, so we've got one from Camilla, and she wants to know, are perennial massages beneficial? And if so, when should you start doing them? I'm 32 weeks now.
Yep, so time to start then. So we say, 32 to 34 weeks, it's great to start. And they are shown to reduce perineal trauma. If anything as well, I think they allow you to start to experience that sensation before it's going to happen. And therefore, you don't fear it, you're not scared of that stretching of the perineum, and you can control it more with your mind through breath work and techniques like that. So I definitely say start now. You can do it as regularly, as you can do it sort of once a week, or you can do it every day. Obviously, the more you do it, the more effect you're going to get. So consider that. But make sure that you're lubricating and make sure that you don't try and go too far and cause some damage before you've had baby.
Okay. All right, we've got a few more to get through. We'll try and wrap it up quickly because we've been going for quite a while, but there's so many great questions here. Okay, so what happens if my baby is breech?
So this very much depends on what hospital you're at. So breech birth happens in about 4% of pregnancies, and it is actually considered a variation of normal. About 20 years ago, a trial came out that said that breech birth is dangerous and shouldn't be done. There's since been evidence to correct that. However, we've lost whole generations of obstetricians and midwives that can confidently practice breech birth. So generally now we only find that tertiary hospitals, those big hospitals in the city, are the ones that can offer that because they have the on-call doctors. What I want to say to you though is you do have options. I used to work at Westmead, which is a centre for breech birth and that specialise in breech birth. We'd have women coming from the country who still wanted a vaginal birth, which is possible, and they would get referred to Westmead and get to give it a go. So what I want to tell you is your options don't suddenly end and it's a cesarean, though that's what your hospital might suggest. You really want to consider the evidence and consider all angles with that. But if it's a hospital that doesn't offer it, normally they'll just book you in for cesarean, but I would say explore all your options. Know that you can get referred to other hospitals, and you know, you have lots of choices to make.
Yeah. Okay. All right. Here we go. We've got a couple more. How will I know when it's time to push, and what is transition?
So transition is generally sort of between 7 centimeters and fully dilated. This is where women will often get that overwhelmed sense of losing control. And this is when they'll want to go home, they'll take off their clothes, yell. This is when you'll see that real primal animalistic behavior. And this is when we get really excited as midwives, because we know baby's about to come. So whenever I'm with a labouring woman, I will always prepare her mentally for transition by saying, look, trust me, this is about to come. And if you can just get through it and you can recognize in your brain, create that link that baby is almost coming, you'll easily be able to get through it. How I describe it, and how some women describe it, is almost like that overwhelming feeling of diarrhea where you really need to find a bathroom and you just can't control yourself. But if you link to that, when you're on the toilet and you're like, it's okay, I'm in a safe place, you know, it's completely fine. So it's just really starting to mentally prepare for that. In terms of pushing, if you have an epidural, often women won't feel the sensation of pushing, or they won't necessarily feel pressure. Some do though. But if you don't have one, a lot of women describe it as that feeling of needing to poo, that you will just know.
Okay. Well, speaking of poo, we're going there. What are the chances of pooping during labour?
Yeah, so this is such a common question, and such something that can be, you know, really drive a lot of anxiety for women, and something that I want to stress to them should not at all. It should be furthest in your mind. As midwives, I'd say as a midwife, probably 50% of women open their bowels in labour, and for us it's a completely everyday and normal experience. We don't even think twice about it. Any healthcare professional in the room is not going to think about it. It's not actually you opening your bowels, it's because baby's head is pressing against everything. So it's baby's fault and you can blame baby. That being said though, I understand that that might not even be answer for me enough. So you definitely can, if you would like to, do things like an enema. If that is going to make you feel more comfortable, then by all means go for it. What you'll often find is a lot of first-time mums don't actually open their bowels in labour, because in that early labour, with all the cramping and everything that's going on, it's all emptied out anyway. It's normally your second, third time mum where it catches them by surprise. But again, like it's not going to faze anyone in the room, and it's completely normal.
Yeah. Okay. And look, let's end with a fun one here.
Okay.
Are there any first wives' tales for bringing on labour that you believe to be true? In America, there is a salad that overdue pregnant women go to eat, and Taria Pitt ate eggplant parmigiana. Is that supposed to do the same thing? What are your wives' tales?
So I've never heard of those methods before, but my view is have a bit of fun with it. This is like one of the only times you can use yourself as a science experiment in this way. And with all this seriousness, with COVID going on and preparing for labour and all that stress and anxiety, it can be a great time for you to just, you know what, I'm going to Google them all and try them all. Some things are like a midwife's brew that you can sort of Google that has all these things in it that can bring it on. I normally say to women, anything that's going to stimulate your bowels is going to stimulate labour, because they share sort of the same wall and it's all happening together. So I'll often suggest that. We tell women raw pineapple because it has an enzyme in it that softens the cervix. We say do walk on the curb side, because that's going to allow baby's head to sort of, so if you have one leg on the curb and one on the main road and you're sort of like, that's going to like push the head against the cervix and mechanically hopefully help things. Sex is a massive one. Again, like I say, like you want to be having a baby in the same environment baby was conceived in. They're the same hormones. So, you know, you and your partner have a bit of a laugh, and that can be a fun experiment. Expressing breast milk and nipple stimulation is another fun thing to try. With all these things to try, however, again, I can't stress this enough, and it's my favorite word. The biggest thing is surrender. What I find most commonly, we have this bit of a saying that like women will come in the day after they're on maternity leave. So they've just finished work and now everything's started and they're like, I thought I would have 2 weeks. And that's because they've let go and they've just relaxed and they've gone, yep, and baby's going, right, it's a safe time for me to come. So yeah, just making sure you're relaxed and your environment's cozy and safe, and trying not to be too anxious about it, because again, it's that counterintuitive catch-22.
Yeah, that's it. Well, at least if you have fun in the process, right?
Yeah.
And give them all the time and see how you go. I think baby's going to come when baby's going to come, right?
Exactly.
All right. Well, Tylah, thank you so much again for being here with us tonight. That's pretty much all we have time for. So a big thank you for everybody joining us here and all of your amazing questions that have come through. If we haven't gotten to them, we will try and answer as many as we can in the comments on the post here tonight. And keep a lookout tomorrow for our prize winner announcements. Thank you to our wonderful sponsor, Mustela. So Tylah, again, thank you for joining us. I can't wait for our next one. And your knowledge is just incredible. And we're so thankful for you being here with us tonight.
Thank you so much. I absolutely love it. It's so much fun.
All right, guys. Have a lovely night. We'll see you next time.
See you guys.